Hello, my name is Nicole Del Castillo, and I am the Director of the Office of Diversity, Equity, and Inclusion here at Harvard College of Medicine at the University of Iowa. Today, I will be talking about the journey to becoming a healthcare provider. I'm originally from Champaign, Illinois. I'm an only child and was raised by my mom, who was a grade school teacher. From an early age, I decided I wanted to become a doctor, which was influenced by my mother. Like you, I was involved in a lot of different activities. I was involved, as you see here, in cheerleading. I was also a part of honor societies, yearbook, speech team, band, and gospel choir. So does anyone know? I want you to try and reflect on what you know about what it takes to become, or the path to become, a doctor. As far as education, typically to become a doctor, you must have a 4-year bachelor's degree and then 4 years of medical school. After that comes residency, which tends to be about 3 to 5 years. And after that, some physicians decide to get further training and to do a fellowship, which is typically 1 to 3 years in addition. Then you become a full-time practicing physician. So I went to the University of Illinois for undergraduate. And I had a good advisor at that time who recommended that I major in chemistry because I would get the majority of my prerequisites, the courses that I needed for medical school, with that degree. During undergraduate, I volunteered at a place called the Crisis Nursery, and I did research. And I also did what you all are doing. I got involved in activities and met people who would expose me to what I wanted to be. I was involved in an organization called the Minority Association of Pre-Health Students, called MAPS, and I worked in a family medicine clinic. Then I was accepted into medical school. As you can see here, there's a picture of my white coat ceremony. So I'd like to highlight here this picture of my class, which included 16 minority students from minority backgrounds. Some of them are not pictured in this picture right here, but this was record-breaking. But for me, it was wonderful for me to be with other students who looked like me and had similar experiences as mine. During medical school, you rotate through different medical specialties, and by 4th year, you start applying to residency programs. So the type of medical professions can be a grouped into either primary care physicians or specialists. Primary care refers to the medical fields that treat most common health problems, such as family medicine, general internal medicine, pediatric. Specialists or subspecialists concentrate in particular types of illnesses or problems that affect specific tissues or organ systems in the body. They may treat patients with complicated illnesses who are referred to them by primary care physicians or by specialists. Can you think of some other medical specialties not listed here? So when I started medical school, I thought for sure I was going to be a pediatrician and care for kids, or a family medicine doctor and have the opportunity to work with a wide spectrum of patients from birth to elderly. However, after I was exposed to psychiatry, there was no turning back. So I did my residency in psychiatry and a fellowship, which is a subspecialty in child psychiatry. I love the flexibility of patients, and I also felt that I was a pretty good listener. So you might ask yourself, not only why should you become a health professional, but potentially looking at reasons why you might not want to become a health professional. Some people see it as it's a lot of schooling, a lot of tests that you have to take, it's long hours, there's not much time with family or limited time with family. You work long hours and year-round, including on holidays. And also, it's a service profession in a lot of ways. But for me, the reason why I decided to continue to pursue my passion to become a doctor was to address health disparities. Health or healthcare disparities refer to differences in health and healthcare between populations, which can be due to one's race, ethnicity, gender, socioeconomic status, and so on. For example, cancer is a leading cause of death for most racial and ethnic minorities. African American men are more than twice as likely to die from prostate cancer than white men. African Americans and American Indians and Alaska Natives are approximately twice as likely to have diabetes as white individuals. As I became more aware of health disparities, I then became more interested in public health. Public health promotes and protects the health of people and the communities where they live, learn, work, and play. After I finished my residency in psychiatry, I applied to Harvard University. I didn't think I could get in, but I did. After getting my master's in public health at Harvard University, it made me look at health and healthcare in a totally different way. I focused on ways to improve health outside of clinical encounters, learning about health policy and laws that can make changes to improve health. So what can you do to help prepare for a medical career? So I recommend building a good foundation, taking courses like math and science, as well as English in writing classes, because as a physician, you do a lot of reading. Develop good study habits, test-taking skills, and writing and verbal communication skills. Ways that you can learn to grow these skills might be joining a speech team or an English class. I would also recommend establishing a strong relationship with your teachers, and also finding mentors will also help you prepare for a career in medicine. Also volunteering. So I'd like to give you a couple lessons to take home with you. Remember that the road is not always straight, from undergraduate to medical school or even your health professions. Also remember that you can do it with hard work and perseverance. Perseverance means persistence in doing something despite difficulty or delay in achieving success. My persistence helped me to get to the place I am today. So if you want to do something, be persistent. Advocate for yourself. Also, for lesson 3, people want to help you. Find mentors and use them. And finally, this is my email. Please reach out to me anytime. My email is nicole-delcastillo@uiowa.edu. Thank you.